Hi, everybody. Welcome to GW Center for Integrative Medicine YouTube channel. I'm your co-host, Dr. Kogan, Medical Director, Associate Professor of Medicine at GW University. I want to show you the study today. Without further ado, we're going to jump right in. Share the screen. So this study was featured at MedPage, which is one of the ways I track every most important news that's coming out in US. And this is a study that's published in British Medical Journal. That's a top premier journal. The team of researchers is from Hopkins, Harvard, I think Boston University. So this is the most prestigious team of researchers. And the title is Burden of Serious Harms from Diagnostic Error in the US. So if you look at the abstract, basically, the study claims that every year, almost 800,000 Americans become permanently disabled or die due to the errors in diagnosis of illnesses. So let's just pause for a second and think what this means. So you have a population of 300 plus million people in the US, and basically 800,000 severe complications, including deaths, attributed to not just mistreatment, but misdiagnosis. And that's in addition to about 500,000 annual cases of errors. So the diagnosis is correct, but the treatment was applied wrong, right? So here now you combine those two things, and now you're looking at about 1.3 million either permanent disability or deaths per year from medicine as usual. So literally, us doing medicine as usual, the standard of care causes this degree of problem. So let's look at the actual methodology of the study itself. So the way they did this is they based part of the analysis on the prior resources or prior data that was already done before. And what was unique in this study, they took a data for 10 years in the largest database of malpractice cases in the United States, which is available publicly, which represents about 30% of entire cases of malpractice in US or US malpractice claims. And they categorized them in 3 large categories. So I'm going to drop you to this category, so just it's visual. We'll come back to this table because this table is the entire study in essence. So they look at 3 categories. They look at the vascular complications. So those are the strokes, different clots, myocardial infarctions or heart attacks, aneurysms and dissections, the infections, kind of the top categories. Interestingly, we talk about spinal abscesses, which is definitely not the very frequent complication. In fact, it's pretty rare if you think about the whole country only has 14,000 cases a year, relatively to, let's say, sepsis, which is, almost more than 1.3 million per year. And then cancer, so also most common cancer. And so this are the big 3 categories. So let's back up for a second. So how do they define the disability and death? Well, apparently there is this standard scale, it's called NAIC, National Association of Insurance Commissioner, where they define the categories. So 6 and 7 is some kind of a significant long-term disability. In like here, for example, is category 6 is some kind of a deafness or loss of a single limb or an eye or a kidney. So it's kind of non-life threatening, but obviously quite debilitating situations. The 7 is a category where you either have some kind of major brain damage, you lose multiple limbs, or you become paralyzed partially or completely, or you're completely blind. So like a much more grave outcome. And then 8 is lifelong problem that's going to dramatically shorten your life expectancy. So something that will, like a cancer, for example, you have less than 6 months life expectancy, and of course the 9 is the death itself. So let's look at the numbers, because I think the entire case, an entire study basically can be summarized by this large table, just table 1. So let's look at some specifics here. First, I'm going to draw your attention to aortic aneurysm or dissection, which is 96,000 a year, so almost 100,000 Americans will have this problem annually. and then 35% will be misdiagnosed. It means 1 out of 3 will be missed or diagnosed wrong, and 22% of those patients are going to progress to a severe harm. So 20,000 Americans every year will either die or have some kind of a permanent disability due to the fact that this condition is missed. Now, let's look at something a lot more frequent, heart attacks. So luckily, we have a lot more accurate tools of assessment of MI, and only 1.5% will represent diagnostic error, which I would say that's pretty good, that's pretty low. But in contrast, you're talking about the stroke or clot, you have somewhere between 17.5 to 20 plus to 24% error rate, which translates to almost double digits, and in some cases more than double digits, more than 10%, serious problems. Okay, so now 30% error rate seems horrible, but look at this. So this is a spinal abscess, and the percent of error there is 62%. So that means that our current standard in diagnosing this condition is just terrible. It's just basically almost non-existent. We're so poor at figuring this out. You look down at the cancers and look at the lung cancer. There's more than 1 in 5 of patients with lung cancer gets misdiagnosed. So either the lung cancer is missed or it's diagnosed as something else, and it leads to 14% of severe complications or death out of those 22% of misdiagnosed patients. So, let's kind of put this in perspective. This is the medicine as usual, right? So this is the care that you will expect to get when you go to any healthcare facility in the United States of America. Some places do better. Are you better off going to a large academic center? Are you better off going to small private office where you may get a particular expert or specialist to be spending more time with you and paying more attention? I don't know. The study didn't really address that. The study looks at, they didn't obviously look at this. They just look at the composite of all the data across the country. But in reality, here's what the main outcome is. The main outcome, our healthcare system is highly inefficient. This is the reason why we're not in top 50 countries in terms of healthcare outcomes. Other countries doing a lot better. I have not personally done comparison, but the data that has ever come out before looking at this issues was definitely not showing such a high percent of severe complications due to poor diagnosis. So what does it mean to you practically? So let's say you are facing a serious diagnosis. First of all, you may want to get a second and possibly third opinion, right? So if you're getting 3 different opinions, the chances are that you're going to decrease chances of error is quite a lot, because you're going to pick up some of these errors. That's one. Second, trusting the original process of diagnosis, to me, is always been a questionable, because of the way that intuitively some of these problems we see in our clinical practice and how many errors are there that we end up having patients come to us after the errors were created, and now we're trying to figure out what to do with it. But knowing all this, it's not only that I'm going to question more diagnoses more carefully, but it also makes me wonder that as a society and as we're transitioning more to AI and more to kind of more of a protocolized approaches to diagnosis. We were just having this discussion in our team meeting today and there was a separation in kind of how we think about this. One practitioner was very concerned about AI, saying there are probably going to be more errors because the people are going to write the protocols for AIs, and that's going to create additional layer of mistakes. I actually don't think so. I think we're probably going to see some improvement over a long period of time. This data that I just showed you in terms of errors in diagnosis is pretty new to me. Like, I've knew that diagnostic errors exist, but not to that degree, for sure. But I was a lot more aware of a problem when people transition from one settings to another. So for example, you get a patient, older person, older adult discharged from the hospital to nursing home, and every single discharge has errors, anywhere from 1 to 5 errors on average, just because there's so many things that the transition team has to follow, right? They have to make sure all the orders are correct, and there's just always some errors. And the American Geriatric Society has been aggressively working on fixing this. So they've implemented introduction in new CPT codes that the primary care doctor, after patient moved from, say, hospital to a nursing home, they get a consultation with physician required by Medicare to make sure that errors are checked and corrected. So something like this can be theoretically implemented for every most commonly causing errors condition. But of course, it's going to take a lot of time. AI will eventually optimize it, but in the meantime, you see the data. So if you or your loved one is diagnosed with something very serious, get another opinion. That's basically what this study aggressively points towards. Otherwise, you're risking getting a treatment for wrong condition altogether. We all in clinical practice see errors like this. They are often heartbreaking and often unfixable. So stay safe. Sorry, this is a very grim presentation today, but it is all part of our healthcare system and our health as a society. And the last point I want to make, I would expect these numbers to get a lot worse overall, and not because eventually AI may get improvements, but because the total number of burden of illness is going to rapidly go up, and you will understand why that is. Mostly because of global warming, we're going to see a lot more toxicity. We're going to see a lot more vascular problems. We're going to see worse diets. We're going to see a lot of complications related to infections. I mean, we're just at the tail end of one pandemic. There are going to be more. So we're basically going to be facing with a more challenging environment continuously, which will cause more problems overall. And unless we really truly get very accurate in diagnosing them, the number of errors, mortality, and morbidity will go up. So all the best to you. I promise next topic will be a bit more positive. So stay tuned for more. I'm Dr. Kogan, and this is GW Center for Integrative Medicine.